Hi, my name is Dr. Bobby Solomon. I'm a periodontist. First of all, I'd like to apologize for communicating with you through this iPad, but I felt that it'd be easier for you to see my face since we're wearing the protective gear and we cannot communicate clearly through them. You've been referred to see me regarding the health of your gums and teeth. As a periodontist, my job is to make sure that there's no infections around your gums and underneath the gums, the bone that supports your teeth. First of all, I'd like you to know that the condition you have is very common. 80% of the population suffers from some sort of periodontal condition. Some could be very severe. The condition is caused by many different factors, genetics being one of them. Certain bacteria can cause severe inflammation once they're trapped underneath the gum and cause the body to create a reaction that destroys the bone around the teeth. Most symptoms could be very minor, and you could have just slight swelling of the gum or redness or slight bleeding from time to time. But most people don't have any pain with this condition, which makes it very hard to diagnose. So, being that you don't have any pain, my exam will show what the depths are around your teeth. This procedure is done by doing a gentle probing, which allows us to measure the depths. Normal teeth in healthy condition have 2 to 3 millimeter pocket depths. Anything beyond 4 millimeters indicates that there's a breakdown of the bone and tissue, which leads to further inflammation and further breakdown. Most of these conditions are completely painless, so you may not be aware that you have periodontal disease. If this condition is not treated, it will gradually increase to a point where the pocket depths could be as high as 6, 7, 8, 9, or 10 millimeters. Normally, when we reach a 10 millimeter depth, a tooth will be lost. After your examination, I'll be able to give you more detail about what level of condition you have and what treatments are possible for you. The most common procedure we do to treat periodontal disease is osseous surgery combining with bone grafting. This is a surgical procedure that allows us to alleviate you from these infections by going underneath the gum and removing the bacteria and repairing the damage that they've caused. This will create shrinkage in the gum and allow you to have access to clean the areas much better going forward. I will share a short video with you that would explain how the procedure is done. What I'd like you to know, many people have had these procedures and have treated thousands of patients over the last 20 years with a very common problem, and we've been able to treat it effectively and get it under control. Unfortunately, there is no permanent cure for periodontal disease, and if it's not treated, it will lead to tooth loss. By doing these treatments, you should be able to contain the condition and maintain your teeth for significantly longer periods. We do recommend that you maintain your teeth after the procedure with routine cleanings every 3 months. This will prevent the return of the condition and further breakdown. There are some common side effects after the procedure. One of the main side effects is shrinkage of the gum between the teeth, which may look and feel that the gums have receded. This is a common problem, and it's created because you have lost significant amount of bone. Our goal here is to make it easier for you to clean these areas and not allow bacteria and food to get trapped underneath the gum. You'll be given certain instructions and tools so you can keep these areas clean post-surgical treatment and going forward. After watching this short video, I encourage you to ask any questions that you may have, and I would encourage you to proceed with your treatments while your teeth are still in a stage where they can be treated. These common treatments will help significantly improve not only your periodontal condition, but we also know that there is systemic links between inflammation and other health conditions, such as heart disease, strokes, lung infections, and arthritis, Alzheimer's, and many more. One of the latest findings that we are working and researching on currently is the interaction between inflammatory process and the interleukin-6, which has been identified as one of the key factors in COVID-19 and patients that develop severe reactions. Periodontal disease is one of the factors that increases your interleukin-6 release. So, treating your periodontal condition will not only help save your teeth, but could also reduce your levels of interleukin-6 and have significant health benefits. Again, I apologize for coming to you through this iPad, but I wanted to make sure that we have a personal interaction and I can answer any questions you may have after watching this video. Thank you so much.